Good afternoon. I'm Brooke Tippins. I'm over at University Hospital, and today is the first day of Black Maternal Health Week, and we're very excited to be connecting with the community on our very first event for this week. I am joined with three powerful, lovely women who are just going to have a very quick little chat and chew just to whet your appetite as it relates to Black Maternal Health Week. If you have any questions, please put them on the chat. For those of you who are joining us on Facebook, you can put your questions there as well, and we will be happy to answer them. And so without further delay, because we know we're trying to get our lunch in, I'm going to turn it over to Annette Harold Vick.
Thank you. Thank you so much, Brooke. Good afternoon. So much for the opportunity to introduce myself. My name is Annette Harold Vick. I'm the president of the Beta Alpha Omega chapter of Alpha Kappa Alpha Sorority Incorporated. I'm thrilled to participate in this very important chat and chew as we kick off Black Maternal Health Week. So a little bit about Alpha Kappa Alpha. Alpha Kappa Alpha was incorporated as an international service organization, and we were founded on the campus of Howard University in Washington, D.C. in 1908. We are the first Greek letter organization established by African-American college-educated women. Chartered in 1934, Beta Alpha Omega became the first chapter of Alpha Kappa Alpha sorority in the state of New Jersey. And under the leadership of our current international president, Danette Anthony Reed, and our North Atlantic Regional Director, Elise Begee-Spearman, we are continuing to soar to greater heights in service and sisterhood as we lead on the first lines of change, education, and advocacy. The Black maternal health crisis is an international social area of focus for Alpha Kappa Alpha. And we are committed to doing all that we can to educate and advocate for better maternal health care and issues that directly impact African-American women. Now, personally, as a mother of two, and as a grandmother, two beautiful daughters, and a grandmother to one beautiful granddaughter, this issue is deeply personal for me as well. Deeply personal. And I know it is for the two great women sitting right in front of me. So I'd like to turn this over to let's start with soror doctor. One of them is my soror, and one is a wonderful community partner. So I'm going to turn it over first to soror Lisa Gittens, and then we'll follow up by hearing from the amazing community partner, LaMonica McIver. Thank you.
Hello, everyone, and thank you so much for inviting me to this event. I'm Dr. Lisa Gittens-Williams. I am on the faculty at Rutgers, New Jersey Medical School, and I'm a maternal fetal medicine specialist. I also wear many other hats. I'm involved and have an office with the American College of Obstetrics and Gynecology, District 3 for ACOG, and I am the Director of Obstetrics at University Hospital. Giving you information about Black Maternal Health Week and the maternal health crisis in the United States is of utmost importance and priority, and I am a self-appointed maternal health warrior.
Thank you. Thank you so much, Dr. Gittens-Williams. And thank you so much, Annette, for just talking about the chapters and your sororities, work into this and the priorities. I first want to thank Brooke Tippins and University Hospital for partnering and, deciding to have this chat and chew. This is a very important topic to me as a community leader, as a mom, as a woman, definitely here in my community, that we spread more information and have more conversation around Black maternal health and, all that encounters with it. In my travels and my work on many different occasions, we have this conversation, especially as a Hear Her ambassador, about Black maternal health and, what does it mean? What are some of the barriers? What are some of the issues? And many people in the community, which is the reason why I wanted to have this chat with Dr. Gittens-Williams, who is doing some amazing work over at University Hospital and with all of the other hats that she wears, just about what does Black maternal health mean? What are we talking about? If Dr. Gittens, if you can just spend some time to, talk about that and share that with those that are tuned in.
So thank you. The reason why we're bringing such great attention to Black maternal health, and in this country and nationwide, is because the maternal mortality rate in the United States for women of color and in the United States in general far exceeds that of most developing countries. So the United States has one of the highest maternal mortality rates than any other developing country. That is of a high economics. That's more than the United Kingdom, Norway, Denmark, other developed countries. And one might think that that's because the United States population is very heterogeneous. We have multiple cultures, races, religions, but that's not really the reason why. And because, in fact, the mortality rate for even non-Hispanic white women far exceeds the other developing countries. So the United States has a crisis. But the United States has a further crisis. And then when you compare the mortality rates for Black women, non-Hispanic Black women, it's still nationwide 2.6 times higher than for non-Hispanic white women. And at all levels of socioeconomics, Black women with a college degree are more likely to die than non-Hispanic white women without a high school education. So that leads us to fully now understand that there's racial disparities and racism that are driving some of these maternal deaths. We have great information in New Jersey about the causes of these deaths, which we can go into. We have tremendous partners at the level of the governor and the first lady, whose Nurture New Jersey program has been challenged, and it's challenging us all to change those statistics. So that's why we have Black Maternal Health Week, and these are the issues, the most important issues. These are the issues of our time, and it is our time to change them. So I'm, again, delighted to be here with you.
Wow. As many times as I hear that number or hear that statistic, it is still just a blow each and every time, right? It's like, oh my God, like that's just awful, to hear the numbers and the statistics, but that's the reality. And that's why, I wanted to start with that question, because many folks, in our community, especially in our communities, don't understand that. They don't understand what we're dealing with. So definitely thank you for sharing that. One of the things you kind of started to talk about that I want to ask as well, is just one of my questions. What are some of the evidence-based solutions to improve Black maternal health in our communities?
So yeah, if we had just a magic wand, we would solve the problem immediately. But I think based on the agenda of the Nurture New Jersey program, the efforts have to be multifold. And so as it takes a village to raise a child, it's going to take the village to save the mother. And so we need really a multi-pronged approach. And several of the initiatives that have been put into place are really important. You number one mentioned being an ambassador for the Hear Her campaign. So the Centers for Disease Control and Prevention have recognized that Black women may be ignored at the time that they're entering the healthcare environment. It's very clear from several cases that have been high profile and published in the news. Serena Williams recounted that she was telling her physicians that she was having a pulmonary embolism, which is a life-threatening clot in her leg, and she wasn't listened to. You know the story of Kyra Johnson in California, who was actually hemorrhaging, and her family, and she tried to get attention, and she was also ignored, and she subsequently died. So the Hear Her campaign is an initiative to get providers to listen to women, bringing to their attention that Black women are often not listened to. There are public figure proponents and ambassadors also for that campaign, including Allison Felix, who's an athlete. And then we have community ambassadors like yourself trying to encourage women to speak up at the healthcare interface. If anyone wants to go to the CDC website, Centers for Disease Control and Prevention, Hear Her, there's actually a script. So you don't have to think about what should I say when I get there and how do I make the doctor listen to me, or the nurse or the clerk at the front desk. There's actually a talking card with a script that women can use to speak out. Okay, some other initiatives are in the hospital setting. Hospitals are now tasked are encouraged to give the same care to all patients. And that's by using something called patient safety bundles. So those are evidence-based initiatives. such that when the blood pressure is high, we give certain medications. When the bleeding is X, we do Y action. And patient safety bundles are being implemented throughout the nation, but New Jersey is also a leader in implementing these patient safety bundles. And I'll say University Hospital is also a leader in implementing these patient safety bundles, not just in the labor room, but in the emergency room, in the outpatient area, anywhere where the life of a pregnant woman could be saved. So those are some of the initiatives that are actually ongoing. But a multi-system approach includes making sure that there's appropriate insurance coverage for pregnant women. And again, New Jersey is a leader in that pregnant women will be having their insurance coverage for 1 year postpartum. Very important, because we do know that 53% of maternal deaths nationwide occur after the delivery. So it's not just that women are dying in childbirth or in the hospital or at the delivery episode. Some of these deaths are occurring later on, and we do have to pay attention to them. So those are some of the major initiatives that are ongoing, but really there are many.
Yes, for sure. Thank you so much for sharing that. I'm sorry, Annette, were you going to share something?
Well, I had a question. You spoke of some of the recent cases like Serena Williams. Can you talk to me about the ebbs and flows of this? Is this issue rising? Has it always been? Where are we in terms of that?
Okay, so that's a really good question. If you want to go back historically, Black women have been experimented on in the field of obstetrics and gynecology. And in fact, James Marion Sims, who is known as the father of gynecology, actually experimented and did surgery on 3 enslaved women who we now honor, recognizing that many of the techniques that have been used to repair fistula, which is a complication of delivery, those techniques were developed and perfected on enslaved women. So the amount of care and the quality of care has always been disparate. And the Commonwealth Fund has some data that reports that literally for the past 100 years, the mortality rate has been higher for Black women. So this is not a new problem, but this is a problem that, time has come to correct it. This is not a new problem, but it's a problem that now the time has come to correct it. And when we look at the data show us that it's not an economic problem. It's not a insurance problem. It's not a neighborhood problem. It's a problem that affects Black women across all socioeconomic groups and in all communities. And so it is a larger problem than saying that these disparities are related to race alone.
And if I'm going to be an army of one, I know we can join different organizations and get behind movements, but if I'm going to be an army of one, if there's one person listening and saying, what can she personally do herself to assist in trying to rectify and to bring resolution to this, what would you suggest?
Well, again, I think everyone's voice is important. And I think the most important thing is to connect with whatever your community organization is. If it's your sorority, then bring that voice to your sorority. If it's your church, you bring that voice to your church. Through the Partnerships for Maternal and Child Health, it is an organization that exists throughout the state. There's one in Northern New Jersey, one in Central New Jersey, and one in Southern New Jersey. Those organizations have linkages to patient education, community education, but they also have connections to all of the other not-for-profit organizations that support maternal health. So I would say use that or those organizations, depending on where you live in the state, as your hub. And then you can use the programs that they have and the resources that they have to get out there and spread the word. I would say I have a daughter who is also in college, and some of us are mothers, some of us are grandmothers. We all have an interest in saving the lives of women. And I would just say that from my experiences, if you're pregnant, the pregnant woman needs that army and circle around her. So I would tell women, share your pregnancy when you know it. Sometimes women don't want to share that they're pregnant, but that could save your life because your pregnancy might not be in your uterus. It could actually be outside your uterus. So let someone know that you're in your close circle that you're pregnant. Find someone to come to your appointments with. have a plan for someone to deliver with you. And the doula care program is another program that's now funded in New Jersey that allows women to have a support person both during labor and, in fact, in the postpartum period that can mitigate some of these risks and complications and can also serve as a voice for the patient. So I would say, to answer your question, connect with the organization of your choice in whatever way you wish to be a warrior, and you can use the partnerships as a resource for that.
I love that last statement that you made about bringing someone with you, because sometimes we don't know, we don't feel empowered to ask the questions, and having someone else there with you being a mom, you've been in situations where you don't, when your children are sick, you ask all of the relevant questions and walk down that road. But a lot of times when it's you, it's like, oh no, but it's okay. It's all right. So I think it's very, very important that you just brought that to light, to say, bring someone with you when you go to these appointments, when you speak to your doctor.
And there's some qualitative data. One is listening to mothers, which is a study that was done nationwide and then in California. And another one, giving voices to mothers. These are qualitative studies that ask women about their birth experience. And from many of these studies, it's pretty clear that women oftentimes don't feel comfortable asking questions. There's a percentage of women in several of these cohorts that have said that they didn't feel comfortable asking a question. So having that additional person present that can be a voice for you, that can empower you to ask the questions that you need to ask can be very, very helpful.
I just wanted to add something to Annette's question about, what can folks do? What can other women do? Or not just women in general, other folks. I always have to bring the politics part into this. Definitely write into your local representative on the federal level to support some of the bills that are on the floor currently right now to support Black maternal health and support Black mothers. That would be always helpful. We do know that, some of these things, as even Dr. Giddens mentioned about some of the systematic, racism, just around health disparities in our communities, which brings us to this point around Black maternal health, definitely has to change with some of the laws that we have, some of the policies and procedures that we have. So always encourage, residents and everyone to, support those, ask your representative to support those bills, on the floor. And I can say that as a, elected official to do so, because those are things that are going to help us, it's going to help us change this and really combat from every different level. It's just not a one fix, one scenario fix, but definitely, supporting those bills and policies that are on the floor would be really helpful. Yes, so I just wanted to add that.
Also, there's the Black Maternal Health Bill, the Omnibus Act, being advanced by Senator Cory Booker.
Mm-hmm.
They're really putting weight behind making change and bringing this kind of disparity to an end, so that we can every woman, every Black woman can get the help that she needs. And, we are talking about maternal health care, but it's just in general, as you spoke of, we in the past have been test dummies, if you will, right? We just walk around and people just use us for different things. And we need to move fearlessly and use our voice without fear of being considered asking a silly question, or my issue that I'm feeling is a little thing. Maybe it's just heartburn, so I won't say anything. So we've got to get out of fear mode and move into action mode so we can advocate for ourselves and others. And bills like the Omnibus Act that's coming forward is critical in doing just that. And thank you, LaMonica, for all your efforts in moving this forward as well, bringing this to light. So thank you.
Great. No, thank you. I know we're running short on time, but I just wanted to also end with one last thing for Dr. Giddens Williams to add. What are some of the tips that you would, give to a pregnant mom on having a successful pregnancy journey and a joyful one at that?
Joyful is clearly the operative word. So, some of the leading causes and complications of morbidity, mortality for pregnant women are hemorrhage and hypertension. So, and then also there's mental health issues. And then in New Jersey, also homicide and suicide are also important. In general, this is the whole population, not just for Black women. So I would say that number one, if you can plan your pregnancy, plan your pregnancy. But we know that in the United States, most pregnancies are not planned. But then have a lifestyle that supports that you might get pregnant. So you would want to, avoid smoking, maintain a healthy lifestyle, see your doctor to correct any anemia that you might have, because that will put you more at risk, of course, if you have bleeding or if you have hemorrhage. When you do get pregnant, there's places to access care. It can be challenging. The United States and many places have maternity deserts where there's just not a lot of providers, or it's difficult for someone to find a provider. But again, use the partnership as resources to get as early prenatal care as you can. If you're interested in getting a doula, learn more about the doula process, engage your family so you have that support person with you at the time of the delivery, and recognize that, in the postpartum period for families and communities, we have baby showers and baby reveal, and, somebody has to hold the mother, right? We're always wanting to hold the baby, but we have to hold the mother. So make sure that in the postpartum period that families are attending to post-birth warning signs, which are signs and symptoms of dangerous things that can happen after delivery. Make sure the family is fully aware of that, and that you're supporting and getting that mom back into care if any of those things happen. And keep postpartum appointments and avail yourself of the fact that there's this extension of coverage for 1 year postpartum that is going to be game changing, and that can really reduce, some of the morbidity that we are seeing. Those would be my tips.
Wonderful. Thank you for that. Annette?
I just wanted to repeat because I was taking notes on that. That it's important to have a plan, correct? To have a plan, but work to plan out your pregnancies, that you maintain a healthy lifestyle before pregnancy and during pregnancy, and that during pregnancy, you need to seek prenatal care. And finally, which is really important, you said that we need to recognize the symptoms of postpartum depression and get help to be a support for others, right?
Yes.
Those are very good. Thank you. Thank you.
Thank you so much for that. I'm going to turn it over to Brooke to talk about tonight's event that is happening, that we're going to have wonderful Dr. Giddens on again this evening, where folks can have the opportunity to, tune in as well. So Brooke, if you want to come in and announce tonight's event, that would be great.
Oh, yes, I did put it in the chat. But for those of you who don't know, we are also going to continue this discussion around Black Maternal Health Week at a session tonight at 6:30. Our very own Dr. Gittens will be moderating that session. I think it's great and timely because she's going to be joined by a doula, a midwife, and other professionals in the health community. So I think it's timely. I think it's important. Again, it's going to be on our Facebook Live page, University Hospital, at 6:30. I can put the link for the Zoom as well in the chat. But this is a conversation that we're having this week, and quite honestly, until we get it right. But because this is a week that's set aside, this is a great way to kick it off. So thanks to Councilwoman LaMonica, who has been a staunch supporter of this work, Dr. Giddens, who this is her life's work, and to Annette, who is really leading the charge with an organization for Black women. This is our issue. So yes, I'm super excited about this week, and this was great. 30 minutes. We get in, we talk about the topic, we tell people how they can really do the work. And for me, I was taking notes too. Someone needs to hold the mother. That is my biggest takeaway from all of this. I know I'm speaking to a group of mothers, but mothers to be, sister, girlfriends, auntie, when you're planning that shower, when she's planning that birthing plan, let's think about how we're going to also hold the mother. So that's what really resonated with me.
I love that. Yeah, that was a great takeaway. Well, thank you all for joining. Thank you, Brooke. Thank you to University Hospital. Thank you, Dr. Giddens. It's so good to see you again. And thank you, Annette, and for everything that you ladies are doing, leading the charge with your strong and mighty organization, getting the work done. So thank you all. Take care.
Everybody enjoy your lunch.
Okay, see you tonight.
See you tonight, 6:30.